Welcome everyone to the second in a series of webinars that we have developed and presented to you regarding about developing medical models or implementing medical models really to provide vision rehabilitation, low vision rehabilitation services. These webinars are sponsored by the Aging and Vision Loss National Coalition and its Access to Quality Services Committee. The committee is one of 4 committees of the coalition, and this one is co-chaired by Ali Dupre and Neva Fairchild. If you want to know more about the coalition, the Aging and Vision Loss National Coalition, get involved with one of the committees, find out what they do, you can visit the visionservalliance.org, www.visionservalliance.org, and you click on Aging and Vision Loss National Coalition. You'll find a lot about the work that we're doing, our annual plan, what goals we have, and we definitely would love to have your participation and contribution to the enhancing and improving and expanding services for people, older people who are blind and visually impaired. So as I said, this is the second webinar. We had the first one in March last year. The webinar and recording and also the presentation, the slide deck are all still available on the Vision Serve Alliance under the Aging and Vision Loss National Coalition. So I urge you, if you didn't have a chance to participate in the webinar last year, I urge you to go back and listen to it if you're interested. So I want to first address the elephant in the room, which I sense, because there has been a lot of conversation, a lot of positive conversation, I must say, about the whole issue of who should be providing vision rehabilitation services, what are the qualifications, what kinds of licenses, certifications, etc. There's definitely a robust discussion going on around the issue of additional certifications provided by or being developed by ACVREP. But again, this is not the place to address that controversy. What we're trying to do today is the following. So as an administrator, program developer, a CEO, you have decided to implement a medical model in your agency, and you need, with the idea that you will be able to access third-party reimbursement through Medicare and other insurance programs. So once you've decided that, what we're trying to do with this webinar is to give you the steps. What are the things that you need to do? What things you need to consider in order to begin that process? This is not even the whole process. We are planning a third and possibly fourth webinars where we will discuss specifically issues around billing, staff training and recruitment, and documentation. So that will come shortly in the next couple months or so. But this one, again, we want to give you the initial steps, also with the understanding that there are many differences. There are regional and based on the provider, the Medicare provider in your areas. So just keep that in mind, that this is not the end of it all. All the information you need additional expert information perhaps in your local communities. Before we start, I want to thank Ali Dupre, the co-chair of the Access to Quality Services Committee, who has volunteered to take your questions. If you have questions, we urge you to use the Q&A feature in the webinar to ask your questions. Ali, as I said, volunteered to put them together, and at the end, hopefully we'll have time to go through some of the lists of those questions and have the panelists address them. I would ask you not to use the chat, because for those of us who use a screen reader, the chat can be extremely distracting because it gets in the way of listening to the presenters and also your screen reader itself. So I hope you use the Q&A feature. And lastly, I want to thank the presenters today. Elsa Zavoda, the Vice President of Adult Services at Vision Loss Alliance of New Jersey, Jennifer Lauer, the Director of Adult Services and the Coordinator of the Low Vision Clinic at Society for the Blind in St. Louis, Missouri, and Monica, who comes to us from New View, Oklahoma, where she is the practice manager. So I will now pass the baton along to Elsa, who will start us on with the presentation. Elsa?
Thank you, Anicio. Good afternoon, everyone. So you probably already received this information when you signed up for this webinar, but the purpose of this webinar will be to introduce you to the process and steps required for an organization to establish a medical model to obtain reimbursement from Medicare and third-party insurances for services provided through a qualified provider. Resources and links to necessary websites and documents will be provided to you to support you in navigating this detailed process. What we will cover today, I will be covering setting up an organizational and national provider identifier, setting up a provider transaction number, initiating the credentialing process with Medicare and your Medicare fiscal intermediary, which is now currently known as your Medicare administrative contractor. And then Jennifer and Monica will be covering registering with a CAQH and setting up a provider profile, credentialing process with third-party insurance companies, hiring staff, the qualifications and considerations with hiring an OT versus a certified OT assistant, and the process for credentialing new staff. Disclaimer, as Anicio just referenced to you, we thought this was important to share, that this is designed to provide a general framework with guideposts of the process to credential an organization or facility in establishing a medical model in order to obtain reimbursement by Medicare and third-party insurances. Helpful links and documents are provided to assist you in navigating this process, which can be complex at first glance. But given that each organization and facility has a different setup and is located in diverse geographical areas, as Anicio mentioned, this information is being offered as a general guideline and is not designed to be specific and detailed to your organization or facility. Please seek further guidance from your regional Medicare administrative contractor. So how do I get started? So step one is enrolling in PCOS. PCOS is the Medicare Provider Enrollment Chain and Ownership System, and it's the online system to enroll in Medicare. So your first step is to visit the PCOS Identity and Access Management website to get started as a facility and also to get started as a provider if you're not already enrolled as a Medicare certified provider. So the website link is here for you. You create one account with the Identity and Access Management System, and that same email and password will allow you, or I should say a login and password will allow you to manage and access going into all of the other sites that you would need to access in order to become fully enrolled and manage staff and also authorize others to access your information. So this is a quick reference guide that you can click on, and this will take you to the quick reference guide for you to review as you start the enrollment process with enrolling in the PCOS Identity and Access Management System. This is what the screen will look like on your landing page, if you will. So this is where you would create your account, create a user ID and put in your password. And this site will also allow you, as you see over to the right, to click over to the other sites as well. So PCOS will allow you to register and receive EHR incentive payments if you are eligible, and also to go to the National Plan and Provider Enumeration System, which I will be covering shortly. So the National Plan and Provider Enumeration System, this is where you're going to establish your username and password in order to be able to access the system. And the website is there. As I mentioned, you're going to use the same credentials that you just used of the account you created in PCOS. And here's where you want to obtain your National Provider Identifier number. So this is what the landing page would look like here. Important to understand that the facility or organization needs to have a National Provider identification number, but you as an individual provider also need to have a national provider identifier number, and then you will link the two together once you complete the process to apply to become an organization enrolled in Medicare, and then being the provider attached to that organization. So this is what the page looks like to show you where your what organizations you are linked to as with your NPI. So here you can see, and I shared a little bit of my information without sharing the tax ID information or my NPI, but you can see that I have my NPI connected to the organization that I'm currently working at now. And I also have my individual NPI, which is active, of course. So the National Provider Identifier Number. So you're going to be enrolling as a facility and then as an individual, obtaining those numbers. And that you're going to need that information as you go forward with the application process. I also want to share with you that there is a national registry that you can go to, the NPPES NPI registry. You can actually do an NPI lookup to look up and see if your NPI is active, just to verify, but also if you need another provider's NPI. I often need another provider's NPI, such as a physician's, for certain situations. When I am verifying someone's benefits and I'm sending that information to our third-party biller, which is what we use, our submitter, I always send over the physician's name, who's going to be sending the OT referral, and also I provide the physician's NPI to the third-party biller, so they have that information. So what is an NPI? So the NPI is an identification number assigned to facilities as well as the individual providers. It's a 10-digit number that does not include information about the provider. It's a single unique identifier issued by CMS's national plan and provider enumeration system to comply with HIPAA administrative simplification provisions. The NPI is intended as an identification number to share with other suppliers and providers, health plans, clearinghouses, and any entity that might need it for billing purposes. The next thing you need to do is apply and set up a PTAN, which is your provider transaction number. A PTAN is specific to Medicare and is issued to providers upon enrollment in Medicare. And in order to participate in Medicare, a provider needs to have both NPI and a PTAN. A PTAN is your unique number, and once it's been approved, once it is approved, it is assigned to that organization. You will need that information for completing the application, as I mentioned before. And then also you will have your own PTAN number created that will link you to your organization where you are working. And you can have multiple PTANs, just so you're aware. Both numbers are maintained by CMS and are required to participate in Medicare. While a provider only has one NPI, the provider may have multiple PTAN numbers, so keep that in mind. If the provider is affiliated and enrolled through represented enrollment through multiple medical groups, practices, or medical contractors. So initiating the credentialing process with Medicare and your regional Medicare administrative contractor, which is MAC for short, because it's a mouthful. This is a really helpful resource that will walk you through the initial process of applying to become a Medicare provider. I also included a list of helpful terms for your reference because you may see some unfamiliar terms as you navigate the process, and you're going to want to obtain definition for those terms. And you'll hear me reference some of them as I go through this part of the webinar with you. So it's important for you to become familiar with them. But this quick reference guide is very helpful. So for enrolling in CMS, you have two options. You can enroll online, or you can download a PDF and complete it on paper and mail it in. Online applications tend to be processed faster according to the website. With the Medicare enrollment process, you're going to go to the online option through PICOS in order to register and access the page. In order to download the applications, you will go through this website here in order to complete the application process and submit it. These are the different links for the different PDF documents that you can download. And if you click on each of these links, it'll take you to each paper document. If you choose to do a paper application, at the time we had done a paper application, just to differentiate them, the CMS 855A is for Medicare provider, Medicare Part A. So this would be for hospitalization, inpatient services, and any home health service agencies that are providing post-hospitalization rehabilitation. Most of us, I imagine, as I did, will be applying for the CMS 855B, which is for clinics group practices, and certain other suppliers. Medicare Part B covers outpatient rehabilitation services, both in the clinic and possibly some home health care agencies that bill under Medicare Part B. Depends on that agency. So you would want, in this case, to select CMS 855B. So that is for the organization or the group practice or facility. The CMS 855I form is for physicians and non-physician practitioners, including occupational therapists, that would complete this application in order to enroll as a Medicare provider. You may already, if you're working somewhere and billing through Medicare, be set up, have already completed your CMS 855I form, or your employer may have done that on your behalf. So you may already have that information, and then you would, as you registered and connect your credentials to an organization, you then have to complete the CMS 855R for reassignment of Medicare benefits. So the reason for doing that is in order to assign your benefits to be billed by the office where you will be working, or the location where you will be working, and for them to bill on your behalf. So that's really important for you to be aware that both of those need to be completed. When you complete this application, CMS 855, it is a lengthy application. It is a fillable PDF that can be downloaded and printed, or it can be completed online, as I mentioned before. You must identify the following: the owner or the CEO responsible for the facility or clinic, and then the roles and responsibilities of the CEO and other designated staff within the facility. You need to be designated as either an authorized official or a delegated official. Both the authorized and delegated officials are affiliated with the tax ID number. The authorized official is an appointed official, typically a CEO, a CFO, a chairperson of a board, depending on how your organization is set up. They must have 5% or greater direct ownership, to which the organization is granted the legal authority to enroll in the Medicare program, to make changes or update the organization's enrollment. The authorized official can sign and initial the CMS 855 application and add or remove delegated officials. So at our organization, our CEO is the authorized official, and I am the delegated official. The delegated official has the legal authority to make changes to the organizational file, but must be a W-2 employee of the organization. A delegated official may not delegate their authority to another individual. There is a lengthy description and delineation of the roles of the authorized official and delegated official. If you can look that up, and I would encourage you to become familiar with those two roles, so that when you're filling out the application, it's clear as to who is the authorized official. You can have more than one authorized official, just so you are aware. And as I mentioned before, it depends on the makeup. I'm at a not-for-profit organization with a CEO, but we also are governed by a board of trustees. So either the board chair or the CEO could be the authorized official for our organization. So the next steps would be to mail in this application and be patient. You'll be provided the designated address of where to mail your application. It will go to your MAC, as we talked about before, your Medicare Administrative Contractor. And the period of review can take up to 90 days, that initial period of time. So to be patient, definitely fill it out online. If you're looking to get it done faster than 90 days, that can speed you along. The designated geographic Medicare Administrative Contractor will contact you and identify areas that may require edits or corrections, which can then be submitted via mail afterwards. You may even be able to fax some of those edits. It depends on your Medicare Administrative Contractor. And know that once you get to that step of the process, that you are contacted by your Medicare Administrative Contractor, it will speed the process along to get things done a little bit faster at that point. Especially when you're contacted, you will hopefully have a contact name, number, email address that you can connect directly with that individual to find out what corrections you may need to make. Realize that there may be edits and corrections that may need to be done, there may not, but if they are, you can contact them and they can guide you through those edits, but no one can tell you who would be the authorized or delegated official. That has to be identified within your organization. So these are the individual applications I had mentioned before. So the CMS 855I is to become a recognized provider with Medicare as an individual. If you will be billing directly as a provider, or if you are in private practice, and if you are reassigning your Medicare benefits, you are now allowing that entity to bill on your behalf and receive payments from Medicare for your services that are rendered. So the provider will be provided with a unique PTAN, which links the provider to each Medicare certified facility or clinic the provider is credentialed with. So as I mentioned before, you have one NPI, but you will have multiple PTANs if you are connected to different entities. And that's important for billing through those different entities as well. So here is in the PICOs. When you log in, once everything is set up, you can go to the page that has My Associates, Account Management, and Revalidation Notification Center. So here's where you can see your connections to the other entities that you are with. You can see your NPI. Mine is blocked out if you see in the upper right there. And then I have 2 Medicare IDs that are listed that I blocked out. You know, the NPI is public information, as I mentioned. The Medicare IDs, I do not believe are public information per se. But just so you're aware, this is where you can view your enrollments, making sure they're active. So it's view and manage reassignments, and then also to check for when you need to update. So if you need to recredential every 5 years, you'll have notification of the time frame on there, or the date or time that you need to revalidate at that time. So here, under my view and manage reassignments, you see that I have 3 organizations that I have been connected to in the semi-recent past, and one is deactivated that I'm no longer working with. You do want to make sure as an individual provider that you do deactivate if you stop working at a particular location from being connected to that organization if you are no longer there. The facility may not do that on your behalf, but you certainly can go into the system and you can disconnect your NPI from that organization. And then you want to check your other connections. So I have one organization here that revalidation has expired in April of last year. I'm no longer connected to this organization, so I actually should go in and disconnect from that organization. I'm now full-time at this organization, Vision Loss Alliance of New Jersey, and it's actually effective as of April 2017. Interesting here, I thought I needed to revalidate every 5 years. Here it says non-applicable, so that's something I need to investigate because I assumed that I would need to revalidate every 5 years. So the next step is getting connected to the your MAC portal, your Medicare Administrative Contractor. You want to establish portal access. You need to do that in order to assign roles to access managers and staff end users that are going to be accessing the system, most likely for billing purposes, but also to review remittances and or submit claims if your entity is going to be submitting claims themselves, or if you're going to use a third-party agency or a clearinghouse, which will be discussed in a future webinar. An access manager is a staff user for an organization who's been approved by an authorized official of the organization. Access managers have access to all business functions to be able to use the portal. So the portal, as I mentioned, is important for you to access because that's where you will be verifying Medicare eligibility of a recipient if they have an active Medicare number, submitting claims, and then viewing remittances. So once the Medicare application is approved, you create an account in the portal to access the other necessary applications, such as the link to the specific MAC portal. The enterprise portal is a gateway that provides access to different centers for Medicare and Medicaid services, healthcare applications, such as your specific MAC portal. You'll request access to the app to access your designated MAC. Once you go in there, you will be assigning roles in the portal for who has access. For example, mine is Novitas Solutions, so I would go in there and then I would establish the providers that will be able to access that portal. So if you go to this link, it will bring you to 50 states and you click on the state and it will tell you which is your Medicare Administrative Contractor. And that way it will bring you right to their website and then you can log into their website, and then this is where you're going to set up the different roles and responsibilities, as I just mentioned, as far as provider office approver. Good to have a backup office approver in case the provider leaves or is not available, that the backup office approver is able to log in. Your billing provider you can provide access to, and also an end user who will be using the system. through that designated MAC. Know that you will be asked to log into your portal frequently to maintain access. I believe our Medicare administrative contractor is going to reduce the requirement, but right now, every 15 days, if I don't actively go in there, I receive an email that I need to log in or else I will be locked out of the portal. So I respond to that email no matter what hour of the day to log in to know that I got in. So it's a good reminder to do it. And then you will be prompted at different intervals to change your password. And it is one of those situations where you want to have a backup to receiving a code through your email or a text message. And also they will not allow you to repeat passwords that you have used in the recent past. So they do keep it very secure. These are the specific geographic Medicare administrative contractors. This is page 1 of 2, just to give you an idea. There used to be, I believe, several years ago, at least, I think there was about 35 fiscal intermediaries at that time. It's been condensed and consolidated to 12 at this time, just so you are aware, 12 geographic entities being consolidated. Also be aware that some areas will have the same Medicare administrative contractor, such as Novitas Solutions, but it's JL versus JH if you pay attention there. So different states are covered in those geographies. So when you go into Novitas, you want to make sure that you are clicking on JL. If you're in New York, New Jersey, Pennsylvania, Delaware, District of Columbia, or Maryland, you also want to click that you are accessing the Part B side of the portal. That's really important as well. So do find out who your Medicare administrative contractor is, and know that each contractor is going to have some slightly different requirements. They're also going to have some slightly different verbiage. So in other words, I mentioned to you a few minutes ago about the provider office approver, the backup office approver, the billing provider, and the end user. When I looked up those terms, that was unique to Novitas. So you may not actually have the same terminology, but you should have similar terminology referencing those same important roles of who's going to access your portal. So this is a map to give you an idea of where these different geographies are. They tend to be chunked together, as you can see, by all the different vivid colors here, the different Medicare administrative contractors. So just pay attention to the geography in your area. Another place you want to go to is the Medicare coverage database. The Medicare coverage database will alert you to what the policies are, the CMS policies, for example, for billing and coding for outpatient occupational therapy. This will include information about what CPT codes are allowed to be covered for services, and also what ICD-9 codes can be approved. You're going to learn more about billing in a future webinar, but know that we use very specific ICD-10 codes for billing for low vision rehabilitation services that are unique to us as occupational therapists. We don't bill for the actual diagnosis of a patient. We bill for the vision impairment caused by that medical diagnosis. And this you'll learn about in a future webinar. But I wanted to alert you to the fact that you do want to make sure that you select codes that will qualify your patient or client to be covered for services. There used to be, and I don't believe it readily is anymore, a local coverage determination policies. In other words, each fiscal intermediary or Medicare administrative contractor had its own local coverage determination policy. So back when I started in the field of low vision, before it was Novitas, I had a local coverage determination policy that I had to review to make sure that I chose the appropriate ICD, I think it was 9 codes at the time, and CPT codes that would skill a person for therapy. When I went to look for the local coverage determination policies currently, I was not able to find them, but I did include a link here to the Welcome to the MCD search, where you can go in and research if a regional LCD is available in your respective area. In other words, when I went in there and looked up occupational therapy, outpatient OT, one came up for Palmetto, Medicare administrative contractor. So you do want to go in there and do your due diligence to find out if there is something that exists that's specific to your area or region. Recredentialing. Typically, a facility and provider must revalidate or renew their enrollment information approximately every 5 years to maintain Medicare billing privileges. So be mindful of that if you do have a time frame that you need to go in, and you don't want to miss that time frame and lose out on being able to continue to bill. If you do, then you have to go through a revalidation process, and that could slow you down. Know that if you are delayed in any way with your billing, you do have 1 calendar year with Medicare to back bill for any clients that you served that during that time frame that you were not able to bill, but you will not be able to bill any further back than 1 calendar year for services. Electronic data interchange form, EDI form, it must be completed and you need to submit it in order to set up a connection between yourself as the billing agency and entity and with the MAC to set up portal access, but you also need to connect your submitter ID, which you'll be assigned by CMS, to your third-party billing agency. If you're going to be using one, to their submitter ID. And I've come to learn also, if they use a clearinghouse, you also need to have the clearinghouse submitter ID linked there as well. And that document needs to be filled out completely for anyone to be able to bill through the portal on your behalf for services rendered. And you can visit this website that I put here for more information about enrolling in electronic data interchange services. More details will come on this later in a future presentation as well. So I'm going to now stop sharing, and I'm going to introduce my colleague, Mr. Jennifer Lauer, who will be presenting the next portion of this presentation.
All right, so I'm going to be taking it over from Elsa after you've done your NPI and your PTAN. What comes next? And that's going to be the CAQH, which is the Council for Affordable Healthcare, Quality Healthcare. So this is a universal provider database. It's at no cost to the provider, but it is for individuals only. So it's not going to be for your facility or your agency. It's only for the individual providers you have working in those areas. The important thing with this is that most healthcare plans, so your commercial plans, uses this portal as a centralized credentialing way that they can go check to see on licenses, malpractice information and things like that. Once you have set it up, you do need to go in every 120 days, update any information that's in there, and reattest that it's all still current and correct. So this is the link to the portal. Now, if you're working with a provider who has ever in the past billed insurance, either through another facility, not so much a hospital or skilled nursing facility, but maybe an outpatient, they probably have a CAQH number. They may or may not know that. On the portal welcome page, there is a help desk phone number where they can go in, call that number, talk to one of the help desk, give their NPI number, and be able to obtain their CAQH number and then kind of reset the portal. But this takes time. So whenever you're going to begin this process, be sure that you have some time devoted to it, and also that you've gathered all the necessary information. It just speeds up the process. It really depends on what provider you're going to be credentialing on how much time it takes. If you're going to be putting in a new OD or MD, it can take a lot longer because they have more fellowships they may have done, or if you have somebody that has a long employment history, it may take a little bit longer as well. So there's a lot of information that you need to collect and gather whenever you're beginning this process. Probably you've already gathered a lot of it if you've already gone through getting the NPI number and the PTAN number, but there may be a few other things that the CAQH portal asks of you that you may not have. So I've included a couple of links. Now, these are just universal credentialing forms. I would strongly suggest you kind of look at them and see all the information that's required that you will need your healthcare provider to obtain and get to you. So whenever you are helping them set up the portal, you have it all at one time. The CAQH portal will not okay the application until all the information is entered in correctly and validated. I keep a folder in a locked filing cabinet in my office that has for each provider all their information. So whenever I need to do something, I have a copy of their license, I have their malpractice information, and it's all just secured, stored. So when I need it, it's quickly accessed. And then I can also keep any correspondence from third-party insurance companies in there as well. So I can go back and look at that information if I need to. So here's just some of the basic information that you're going to need. Their personal information. It does they require to have a birthday and social security number, so that's why it stays locked away. Any specialties, board certifications. If you are credentialing an MD, you would need to have any hospital affiliation information that they have, practice location information, malpractice insurance. If they've had any malpractice claims in the past, they want to know that as well. The professional peer references is really for more MDs that may be going through a fellowship. So it's not necessarily your OTs and OTAs, but they do have a place that you can upload those forms if you would like. And then your work history. And just like Elsa was mentioning, you can go in and edit those so you can deactivate places if you're no longer working there and upload new facilities if you're adding new ones. You also need some supporting documents, the IRS form W-9. If you're talking to doctors, the DEA, CDC, everybody will need their state license. And then you need all those numbers that Elsa was talking about, the UPenn, the NPI, Medicare number. If you are going to be billing Medicaid, your Medicaid number as well, and then your malpractice and professional liability insurance. They will send you emails about 6 weeks prior to the malpractice insurance getting ready to lapse. So you have ample time to get that and get it uploaded, as well as your state license. So when you go in there, they'll let you know that it's getting ready to expire. So they do send out emails to alert you when it's due to reattest, or you have a supporting document that's getting ready to expire. This is a screenshot of what it looks like once you get inside the portal. This is showing is that I've completed the application, that all the different things that forms have been uploaded, and then you'll see that it says status approved. So occasionally you will have them kick something out that it's not approved, it didn't meet the standards of what they were looking for. So if you're doing the initial application for that to get into the portal, be sure that you're checking it every day to make sure that the things that you uploaded actually were approved by CAQH. And then this is showing that up at the upper right side is the review and attest. So that's where every 120 days, or if you upload or change any information. So if you go in, add a new document, upload a new license, you will need to be sure that you also review and attest to that it's updated. And then it will tell you the last time you did it. And if there's anything that a required field that's not complete, it would show in red, and then it would take you to where you need to correct that information. This is the authorizing third-party insurance companies. So you can do this one of two ways. You can either authorize anybody who wants, any insurance company that wants to look at your CAQH data, that they have access to it. They will give you an email to let you know who's viewing yours. If you decide not to do that, you would get the email saying that somebody's requesting to view your CAQA portal, and then you would have to go into the portal and authorize it or not authorize it. Now, typically these only come through when you're trying to get your third-party authorization. So it's not just usually random, but some insurance companies will receive if a new CAQH number has been created, and they'll go in and do it. So that's your choice, but then you have the ability to authorize or not authorize. So that's the CAQH portal, and that really has to be done. It's kind of, you have to have your MPI number, your PTAN number, and then you need to do your CAQH before you start looking at third-party insurances, because most of them will use that portal to verify your information and kind of as a centralized credentialing. The important thing whenever you're looking at third-party insurance companies is to really focus on the first top 3 to 5 insurances that you know you're going to be seeing with your clients. It can get a little overwhelming if you're doing all of them. So identify the first, the 5, even 3 to 5 of them that you're doing. Today, I'm going to focus on Aetna, Blue Cross Blue Shield, Cigna, Humana, and United Healthcare. Now, also, you may have individual Medicare Advantage programs or insurances that are in your general area. So if you have that, you may also want to explore doing getting credentialed with them as well. So first with Aetna, this is the link to get you to join Aetna. Now, if you're credentialing individual providers, you can do this. If you are credentialing your whole facility, you will need to credential the facility first using the facility's Medicare number and using the tax ID, and then you can link people to them. So this is more focused on, you've kind of already gone through that. You can go through the process together where you're credentialing the facility as well as the individual at the same time. But for Aetna, this is the portal that you will use. And you kind of will still need all the information, the group information, as well as the tax ID, the practice location, the billing information, who's going to be doing the billing, and who's the point person. They'll always want to know the contact. So typically you want to find, even though you're credentialing the provider, you'll want to have one contact person that's receiving that information, just in case there's a miscommunication between the provider getting it. And with Aetna, I have found it's really important to follow up with them with phone calls and to find out if they got it, if they got everything, because they may or may not get you a confirmation email that they got it. So next, we're going to talk about Blue Cross Blue Shield. Blue Cross Blue Shield, you can actually set up an account with Availity, and it is a clearinghouse. So with Blue Cross Blue Shield, you can do all the credentialing and through that, but also the added benefit of Availity is that you can do pre-authorizations and referrals through that portal, not just for Blue Cross Blue Shield, but also for Humana. You will still need the personal information and the professional license. And if you've just recently set up a CAQH for a provider, you may need to wait about 7 days, because they will search their number. And if you haven't got a fully approved CAQH application yet, they won't let you go any further in the credentialing process with Blue Cross Blue Shield. But the nice thing with that is that you have the portal that you can go into. It will tell you what stage you're in the process, received, all the information's collected, and then it will give you the active date of when you can start using, having your provider bill for Blue Cross Blue Shield. Next is Cigna, and Cigna, the best is really to call Cigna and talk to a representative. They will walk you through, they can search the NPI number, the CAQH number of the provider you're trying to credential to see if they've ever been credentialed through another facility. And if they have, it's a different procedure if you're being added to a network or if they're being credentialed as a brand new provider to Cigna. So the best, I've tried it both ways, and really the easiest is just to call Cigna and talk to one of their customer representatives, and they can walk you through all the information that you're going to need to be able to get that provider added to your group. And again, you want to have everything handy with you when you're talking to them. Next is Humana, and Humana has a website that you can go to. They work, you go into the website, you request credentialing, and then you will start getting emails, and they usually come from a secured email account. The first step that they have you do is they will send you an Excel sheet that probably has 40 different fields in it that you complete, and then you send it back to them. Then they will say if you got the data correct. If you did, if they've got all the information that they need. If they did, then they'll again start sending you emails. The nice thing with Humana credentialing, because of the way they do it, if you need to credential more than one provider at a time, you can list all of them on that sheet. So it makes it a little bit better than having to fill it out, or you still have to fill out the information for everybody, but you don't have to keep going through the process. They'll send everything as a group. And then you can check the status of the credentialing on Availity. You just can't initiate the status on Availity with Humana. And the next one is United Healthcare. So the website that I have a link for is kind of a more of an informational website. It's kind of hard to navigate and know where you need to go. So again, I have found that it's easier just to call the number and talk to a customer representative. Again, they can help you know if the person has been credentialed with United Healthcare in the past and need to be added to your practice, or if they need to be credentialed all the way through. If because in general, if they just need to be added to your practice, then the credentialing process takes a lot shorter amount of time than if they need to go through the whole process and they have to check everything. And again, be sure you follow up with UHC to make sure that they got the information either through emails or phone calls to see if they got it and if it's correct and if they need anything else, because they won't, sometimes even with all of them, they don't always reach out to you to let you know that they did or did not receive all the information that they need. So some best practices are really review every application before you send it off, whether you're doing it on paper, sending an email, doing it through a portal. Make sure that all the information is correct, those numbers are correct. Double check everything, because if information goes out incorrectly, you will spend way more time trying to get it back correct if the billing address is wrong or the location practices address is wrong, phone number. So just really be sure that even if you have somebody helping you do that, or you're letting the providers kind of do it for themselves and then you're reviewing it, just make sure that everything's accurate and correct. And then the follow-up. I have had an experience where I didn't follow up and realized that I had a provider that actually was credentialed 3 months before I realized it. So always follow up on whether they got it. Did they get everything they need? And then just asking them, has this person been able to see patients now? When have they been effective date is the best practice with that. And it'll just help avoid delays on the billing side of it. Some pitfalls is encountering closed insurance panels. I haven't really encountered that so much. I have with one optometrist. We had a local Medicare Advantage that we're no longer accepting optometrists into the insurance panel. However, because low vision is a specialty area, we were able to get her in. So chances are you won't encounter that, but definitely if you do, reach out to that insurance company and let them know that the specialty is low vision, and that may open them up where they can get into that insurance panel. And then never assume that a new person has been credentialed, even if they have an NPI number. You want to find that, because this process can take a really long time, months. And so if you think that they have the number and they get there and you're ready to start having them see clients and then they're not able to, that can be problematic. And making sure that you update any name changes or address changes, or even if you decide to have another location and you need to have a second location added, be sure that you're updating those with all your insurance companies that you bill for. And I will turn it over to Monica.
My name is Monica, and thank you guys for being here today. My part of the presentation is occupational therapy, and I'm going to go over some of the qualifications for the occupational therapy. What is an occupational therapist? Client-centered health professional concerned with promoting health and well-being. They work with individual groups and population across the lifespan. Licensed registered healthcare providers. The status of an OT profession. OTs work with patients to help them develop, maintain, and improve skills to perform daily living skills. This health field continues to experience increased employment growth due to a variety of factors, such as aging population and policy development. It is estimated that the occupational therapists are projected to grow 14% from 2021 to 2023. These settings include hospitals, clinics, rehabilitation centers, home health goals, industries, community, and private practices. As of now, there are 174 entry-level accredited schools in the U.S. Occupational therapists and vision loss. There are several ways for your OTs to be trained. Graduate certificate programs. The University of Alabama at Birmingham is one. Fieldwork in a vision setting, mentoring, and concentrating on continued education. First, what you want to decide is if you're wanting a generalist OT or a specialist OT. And the differences between those is your generalist OT can work in any practice setting, basic knowledge of the vision impairment, ability to adapt to the task and environments to meet the current treatment goals, and knowledge of acknowledgement of the referral sources. Your specialist OT, they're trained to work with your clients with vision loss, assess and treat for the loss in ADL function, includes application of AT environmental modifications to meet goals, diabetic self-management, myoptic driving, neurology vision loss, and able to address secondary health conditions. The goals of our OTs, its primary goal is for the patient's quality of life, to increase their independence in everyday activities. They would like we try to have the patients where they age in place, to keep them out of the nursing homes, helping to make the simple modifications to help them in their daily living skills. And some of those services include home modifications, in-home task lighting assessments, glare reduction, training in low vision adaptive devices, and technology modifications. Things to look for in an OT when you're hiring is clear expectations, leadership regarding OT. The next decision to make is if you want a specialist or if you want a generalist. If you're wanting a generalist OT, mentoring by a specialist OT to ensure that they're getting the quality that they need in their specialty, especially with low vision. How to locate an OT. There are several different ways to locate an OT. You can contact a university with graduate certificate programs, contact state associations, contact an established OT currently working in low vision. How to retain your OT. Understand the depth, the training and profession. A good link is the American Occupational Therapy Association. Allow them to work within the scope of their practice. If trained, they don't need supervision. Ensure they have an adequate salary. The most of the OTs is in May of 2021. The average salary was $85. Make sure they're registered and licensed and able to bill through insurance and Medicare. Additional considerations in your OT clinical setting: administrative staff, referrals, and clinical judgment. In the billing aspect, your OT can increase your revenue expansion, diagnose and billing codes, and billing compliance and changes. Ultimately, this is a great match. Trained in disability and aging, address physical and social needs, positive focus to emphasize clients' daily functioning, and reimbursed by Medicare and insurance companies. Along with the daily living skills, your OT assists individuals with instrumental activities that can include the care of others, financial management, community mobility, and health management, to name a few. OTs also assist in individuals in leisure and work activities, and each state is different. As in Oklahoma, our occupational therapist programs, we have two. We have one through the Northeastern State University and an Oklahoma University. And through the Tulsa Community College has a program for occupational assistance, which is taken through associate degree. And now I'm going to turn it back to Jennifer.
All right, so process for credentialing new staff. So this is going to be the new hires you have coming in that you need to get up and running so they're able to bill insurances, whether it's your MD, OD, OT. So once your provider has signed the offer letter and they're going to join your team, I would send out that uniform credentialing form and get all the information you can right from the beginning. It is quite lengthy for the provider to complete, but the time that it takes on the front end will save you so much time on the back end. And actually have them return that to you as soon as possible, even if they're not planning on starting for a few weeks, because this credentialing process can take anywhere from 6 to 8 weeks. And that is if they have their NPI number, if they have their Medicare number. If they don't have those, you're even looking at a lengthier amount of time. So the more time you get before they start, the better off it is for you. And so that's then the next thing is you need to kind of determine if they have an NPI number, a Medicare number, a Medicaid number. Sometimes they know if they do, but if they've worked in a facility, somebody else, a credentialing specialist, may have been doing that for them, so they're not really sure. You can look up somebody's NPI number just doing a Google search of NPI lookup. Medicare, Medicaid, and CAQH, you can't necessarily look those up. But in the portals, if you try to input their NPI number, it will tell you this provider already has the number, and then you just got to do some legwork to figure out what it is and have them try to obtain that information for you. And so then also determining if they're in network with any insurance companies. So like I kind of said at the talking about insurance companies, third-party payers, if they're already in network with a commercial insurance because they've been billing at another facility that they've been working at, it's a lot easier to add them to your practice than to start the whole process over. So that is, and then that really takes a phone call to the customer service of whatever insurance company you're trying to get them credentialed with to see, and then they can let you know, yes, they're already in our system, they're linked to another practice, and then they can walk you through how to link them to your practice. So once you really have all the provider numbers and collected all the information and the supporting documentation that you need, then you can begin the process. And it's really from that point, it's the same as if you were doing for the first person, or now maybe this is the fifth person that you're trying to get credentialed. You have to go through the same steps. It just does get a lot easier the more you do it, especially if you're able to make some contacts with the insurance companies. If you have a person that will answer your emails pretty regularly, that's always beneficial. I keep folders in my emails for each provider that I'm credentialing, and everything that comes in on that provider goes into that folder. So whenever I'm trying to see what's the update, what's the status, everything's located in one information or one area. When you do get those effective dates, you want to be sure that you get that information to your billing person, whoever that is, that this provider's now okay to see this particular insurance. Here's their effective date. Here, if they issued a different number, that everybody has that. So whenever they start to bill, then you can make sure that those claims are coming through clean. It really depends on the insurance company of whether or not they retroact. Blue Cross Blue Shield usually will go back maybe 30 days. So they'll let you know, oh, 30 days ago, you could have started billing. But most of them will do a forward date. So they'll maybe let you know today that starting May 1st, they can start seeing patients or billing for patients. So it's just each individual insurance company is a little bit different on how they manage that. I think the most important thing when you're dealing with the insurance companies is to keep organized, stay on top of it, and follow up with those insurance companies on what the status is of the credentialing process.
Thank you so much, all of you, all three, Monica Rayner, Dr. Jen Lauer, and Elsa Zavora. It's been wonderful. I know this was a lot of work to put it together. So again, my thanks go to you. As I mentioned at the beginning, if you have any questions, and I'll ask Ellie in just a second if we have any questions, but if you do, please make sure to write them into the question and answer section on this Zoom application, and we'll have the panelists answer your questions. Since I have the microphone, I'll take the liberty to ask the first question to any of you, really. But so this obviously is a very complex and it sounds to me time-consuming. And Jan, you just mentioned a little while ago that it could take months and all that. But my question is there any way? I know with some insurance you cannot, but are there some, or Medicare, where you can bill while you're going through the process, and not bill, but provide the service and bill retroactively? Or is that a no-no?
I would not do that. I would make sure that you have the effective date for your provider, and you can't selectively choose who you're going to bill for and who you're not. Mm-hmm. So if you have another provider that is already credentialed and now you're bringing in a new one, you just have to be very mindful to make sure that the new one is only seeing clients or patients that they're credentialed with. And then you have to kind of move everybody else to the other one. So you can't just decide to not bill an insurance company because your provider is not credentialed. Right. So yeah, it's not a good practice to retroact bill and hope that it's going to work.
Right. And for a brand new facility that needs to get their own number and then the staff, et cetera, is there a ballpark figure of how long should one estimate to take before they can start providing services?
I would say between 4 and 6 months.
Right. That's a...
If you had to start brand new, Now you may be able to, because Medicare usually is actually pretty quick. I mean, it can take a while, but it is probably the quickest of all of them. And so you may be able to see Medicare patients. But I would plan on spending some time working on the credentialing process.
Mm-hmm. Great. Thank you so much. Ali, do we have any questions on the question and answer?
We do, but Elsa mentioned that she had an additional comment she'd like to add. Do you want to do that now, Elsa?
Sure, Ellie. Thank you. I apologize I didn't mention it during my presentation.
No problem.
Thank you. If at any time, and I'm especially referencing CMS here, there's a change of ownership, meaning your authorized official leaves the organization, such as what happened with our organization, it's important that before that person is removed from the profile, if they're the only one who is an authorized official, that you add the incoming authorized official. So in other words, that way there's the transition to that new authorized official, and then you can go in and remove the previous authorized official. We had a situation occur for us, a transition of leadership, and that's where we lost our ability to bill Medicare because we had the change of leadership and the authorized official was removed from the account before the new authorized official was brought in. So that's where we were left for a few months needing to resubmit to CMS to activate the new authorized official. And we were luckily able, as Jen mentioned, you're not always able to back bill for services, but because we were already credentialed, we were able to back bill for services once the new authorized official was in place, but there was no guarantee that that was going to happen. So important also to consider maybe having two authorized officials, if possible, at an agency in case one does leave.
Is that true also with a delegated official as well?
A delegated official cannot act in the place of an authorized official. So I was not able to act in place of that authorized official that left. So our account basically went on hold with Medicare until we were able to rectify the situation at the time, which luckily we were able to rectify in a short amount of time.
Right, right. Okay, Ali.
Okay, the first question that we received was, how does the 5% owner requirement work for nonprofits who don't technically have owners?
Yeah, we had to navigate that one. We were not sure as well. Technically, we are governed by a board of trustees at our not-for-profit. So technically there isn't an owner of the company per se. So it is the CEO who was assigned that responsibility. You have to read the criteria carefully to make sure that whoever that designated person, it does say if you go through the documentation that a CEO would qualify, or the board chair of a board of trustees would also qualify in those situations, because I am also at a not-for-profit agency.
Okay, I hope that is a good answer. And if not, put some more follow-up in there. Okay, Anissa? The second question is, how does one bill when a patient calls and asks for letters that describe eligibility for transportation groups or other kinds of benefits that they're eligible for? In other words, the patient's taking up your time asking you to support their eligibility for other benefits. How do you bill for that?
You really can't bill for that. I would assign those responsibilities if you have some type of a social service coordinator within your agency, a family member to support them, or if there's another agency in your community that can provide some support to that individual, but we cannot bill for providing those types of services to a client. We cannot bill for our documentation. So just so you're aware.
That's all the questions I have. I thought that the presentation was very clear. I could follow it.
Yeah,
I wish I had it when I was trying to do this myself a long time ago. I think it looks like they've actually improved the process a lot.
Yeah, and just as a word of for those in the audience that were visually impaired, obviously the presenters, it does not lend itself to read every single link on a slide, but just be sure that you'll be able to get a copy of the slides and all the links are there, so you'll be able to actually follow a little bit better.
If you click on the link, right click on it, well, obviously if you're using JAWS, you're going to use a different keystroke to access the link, but if you click on that link, it will open in a new page. for you.
I did just get another question. It is my understanding that a nonprofit 501c3 is not an approved entity to bill Medicare in New York State. Can you speak to this?
Unfortunately, I cannot. I'm in New Jersey, and I believe Novitas Solutions, JL, is also in New York as well as New Jersey. We have no issue billing for services as an identified not-for-profit agency 501c3.
Yeah, and this goes back to what you were saying before, right? Also about there are so many differences from one state to the other and one region to the other. So it is important to consult with your own experts in your area.
Yeah, I would contact your Medicare administrative contractor to investigate this, but it should not be an issue. There's many not-for-profits that provide OT services and are reimbursed for their services.
Okay, you've answered all the questions that I have again.
And one thing I learned today is that Mac is a lot more than just a computer.
Or a hamburger.
Well, if there are no more questions, I really, on behalf of Vision Serve Alliance, and I know Lee Nasahi, the CEO, would love to have been here, but unfortunately, I believe she's still out of the country visiting family. And Libby Murphy would have been here, but she's at the AFB Leadership Conference in DC. But on behalf of Vision Serve Alliance and all the chairs of the various committees of the Aging and Vision Loss National Coalition, and of course, my friends Ali Dupre and Neva Fairchild from the Access to Quality Services. I want to thank you again for all your work on this. And for those of you in the audience, stay tuned for Helen will let you know when the slides and the recording is posted on the website, so you can go back and review it, and also when the next webinar takes place, where we will focus more in detail on billing issues, documentation.